Let's now take you to the northwest, where health authorities are concerned about a sharp increase in COVID-19 infections, particularly among health workers. A week ago, 12 health workers tested positive for COVID-19 at the Tigane Community Health Centre in Hartebeesfontein near Klerksdorp, while at the Klerksdorp Hospital, 49 health workers tested positive. For more on this, we touch base with our reporter, Bafedile Moerane. Bafedile, very good morning to you. Some really concerning numbers as the spread of COVID-19 continues.
Yes, indeed, quite a concerning issue for the Provincial Department of Health here, and they have also made a plea to residents, as we know that a high number of people will be traveling across the province, others coming through, others going out, and they have made that appeal to say that, people should be conscious when they travel and when they are meeting with their families this particular festive. But however, I'm going to talk to the MEC for Health in the Northwest, Madoda Sambata, about the measures and what is it that they are saying to the residents here. MEC, thank you so much for joining us. We understand that you're also concerned about the increase of COVID-19 cases, in particular for the health workers. Tigane Community Health Centre was closed, and also a number of health officials at Klerksdorp Hospital were also affected.
Yes, it's true. We're seriously concerned about the rate of transmission amongst healthcare workers. Remember, this is the backbone of government response strategy to COVID-19. If they get huge number of impact, it may then create a problem where normal health delivery is going to be affected. We must first thank them for the extent to which they've stood between COVID and all other diseases in defense of the community and helping our communities. But here's an issue. Healthcare workers have some double elements of exposure. One, they are exposed in the workplace. Two, they are exposed in the community. That's why whenever you speak with them, you need them to have extra care. But nobody will ever have extra care on COVID. If you are unable to avoid clustered spaces, if you are unable to deliberately put on your mask at any given time, if you are unable to give social distance, but because of exposure in the workplace and exposure outside, they then get a serious number of them highly affected. Now, like you have said, once the number is high, like it was in Tigane, you then have no option but to change shifts of operation of a facility, because they are expected to take their isolation days. During isolation, you don't have a great number of them available because they must finish isolation and come back. They must not be exposed deeply, even at a time when they've already tested positive.
I just wonder as to what measures do you have, in particular, looking into the Platinum Belt there. I understand it's one of the hotspots once again this time around in the increasing numbers. When people come back from the holidays, what measures do you have, in particular, working with the mining companies? Because remember, at the beginning of this pandemic last year, we saw a skyrocketing number of COVID infections, in particular because of the people who were making their way from home to the mining sector.
Let me also contextualize the growth so that people see that this is becoming real. A month ago, November, on the 19th, we had only 672 cases, 672. As of yesterday, we had 15,000 cases. A month ago, the total number of people in Northwest who would have tested positive, including recoveries and deaths, were around 150,000. Just yesterday, we were around 170,000. It tells you that the numbers are growing exponentially. But what we see, it's nationally and internationally, that Omicron spreads like wildfire. Now, everywhere where we have serious numbers, first, in the mining belt, both Dr. Kenneth Kaunda and Bujanala, because of the impact of people going to other provinces during that period, we will again enforce testing whenever they are coming back. That we will do with the mining industry, mineral councils, and Department of Mineral Resources, that whenever they come back post-Christmas and New Year Eve, they should be tested, because none of us would know how they were behaving, where they were, so that they do not come back and then further increase the numbers we have. But this is becoming a societal issue. Wherever we are, we must be sure that we comply with non-pharmaceutical measures for COVID response, so that nobody exposes any other person. This time we are calling on everybody in our province, Northwest, that let's deliberately on our own avoid clustered areas, avoid meetings that have too much congestion. We must not wait for government to do a regulation to reduce meetings or to do a lockdown. On our own, let's prove that we do care for each other.
Well, thank you so much, MEC Madudasamba here in the Northwest, contextualizing to us as to how they are concerned because of the increasing numbers. Just this weekend, it was 1,294 new COVID-19 cases here in the Northwestern Pole, and you can see that it is really a very serious, sharp increase indeed from the Northwest rather.
Very well, Bafedile Moerane, let's leave it there for now. Some serious concerns, especially when it comes to health workers and the spread of COVID-19.